one. I want to welcome Dr. Thomas Dobbs to the State Health Officer of the State of Mississippi to the Zoom today. I'm having a little bit early. It's early today. It's 8:30 that we're recording this, and I'm usually not thinking this time of day. Dr. Dobbs, I want to say thank you for not only joining us today, but for the service that you're providing for the state, because I know that the last few months have seemed like about 20 years. And I appreciate you taking the time today to talk to us a little bit. I was just doing a little bit of research about your background, and if there was anybody on the planet that should be doing this job right now, it's probably you. It seems like everything you did kind of prepared you for this moment. Tell us a little bit about yourself and about how you got to this job.
Well, thank you, Marshall. Ever since, I'll tell you, when I first wanted to be a theoretical physicist, that was my first goal, but it didn't really go that way. There weren't that many opportunities, so I switched into a medical school, which was fantastic. But early on, had a real fascination with public health and understanding, what you can do from a population perspective to treat that population almost like a patient, so you can hopefully be more impactful. And so I had kind of a combined clinical public health sort of training and sort of work experience when I was in internal medicine residency. I focused, actually spending a bit of time in public health, and I got my master's in public health during my residency. Actually, I took my courses during rotations. I had to sneak out sometimes to take my exams, just to kind of get it knocked out. And then went into infectious diseases, which is a pretty good, public health sort of situation, as you can imagine, and really spent a lot of time on HIV and tuberculosis. And a lot of my specialized work was in those disease processes and where they combined, and had opportunity to work overseas a good bit, both in Russia and in Southeast Asia. And then moved to Mississippi. My wife's from Mississippi. I'm from Alabama. We wanted to kind of get closer to home. Moved from North Carolina, and I started the hospitalist program in Lowell. Worked as a clinician for several years, and then worked also in infectious diseases. Had an HIV clinic. Joined the health department. I guess back in 2008 with the regional health officer. And still did clinics and stuff and consultations then. State epidemiologist, which is a fantastic experience. It's a wonderful, fascinating job. A couple of years I spent back at South Central as their chief quality officer, chief medical officer, and worked. And then when Mary retired, they asked me to kind of come on board, which who would have known the timing? Exactly. that was something else. But it's really great work, and we feel like we can make a big impact. Public health really has a spirit of service, and it really is public service, and I'm proud to have the opportunity to do it.
It's amazing. Dr. Currier retired almost exactly 2 years ago today, so which means you've been state health officer for the last 2 years since December, and I was thinking probably the last year has seemed like 20.
Oh boy, when we look back on when all this started, I'm like, oh gosh, it's only been like 7 months ago. Are you joking me? It seems like forever.
COVID time, and there was one point where you had not even taken a day off. I hope you're getting a little bit of a break.
Actually, I took my first day off this weekend, and very, very, very happy to have it. I think I needed it.
I would think so too. That's really a big component of this is a mental health part of it, and it's you start seeing statistics like 40% of Americans are going to be depressed and so forth. Is there anything that you do to try to be able to stay focused and being able to function? Because you're seeing and doing an awful lot, like 18 hours a day.
I think being active and being outdoors is really helpful. It certainly helps you clear your mind. One of the things that's been really neat about the pandemic that I think we can continue is we've bought every bike in the state, right?
Right.
I kind of live near the reservoir, and so I'll try to get on the trace, the little the bike path regularly and see a lot of folks out there. And so that's really good. I think mental health is very important. And I think, unfortunately, we have this sort of binary concept of closed or open. Yeah. And really, it doesn't have to be closed or open. It really just needs to be, hey, we can do most everything, but these few little things we can't do. Cook with your family, go outdoors, get some exercise, go to work, read. There's a lot of healthy, mentally reinforcing things we can do. We just can't go to big parties. We can't go out to bars that are crowded. We can't go to big social events. And sadly, we don't really need to be having big weddings and need to avoid funerals. Those are tough because those are sort of critical life events. But those are some of the things I think that we really just have to be careful and really practically we need to avoid them.
That's been really tough though, because I mean, I can't think of anything more Mississippi than getting together and throwing a party and hanging out. We throw parties for everything. So, and we kind of went through the hump over the summer, and we did the mask mandate, and numbers started coming down. And when the governor, and one of the things I do appreciate about you is you don't really do politics; that you're science driven. I mean, all your decisions are based on what's going on. And the governor made the decision to remove the mask mandate. And it kind of had the weird effect of almost like blowing the all clear. Because one thing I noticed was suddenly everybody running around weren't wearing masks anymore. And
I can't tell you. I really thought we had learned our lesson. I mean, honestly, I've realized I'm not really a good judge of mass psychology. I mean, if you look what happened in the summer, how bad it was, how many deaths we had, we overwhelmed the healthcare system.
yeah,
We turned it around, and all we had to do was just kind of keep it up, and we didn't. And it's I kind of like even with the fair, I was really disappointed that they pulled the mask thing. I think that
yeah,
was not a great idea. And we've seen situations where like and I don't think there should have been social events anyway, honestly, but we like had a situation where there was a parent sponsored social event at school, and then the day the mask mandate was lifted, it said, "Hooray, no masks! Y'all can go forth and dance without masks." And actually, there's a pretty bad outcome with that.
Schools, it's amazing. My wife teaches and she's around kids all day, and the numbers have been pretty good at her school so far. It's like what's going on in school with the masks and the social distancing seems to be working. But one of the things I've seen, and I've heard you say this, that a lot of what you just said just a second ago, a lot of it's being driven what's going on outside of the school.
Yeah, we've been really extremely pleasantly surprised by how successful school reopening has gone, and really have to give all the credit to the schools, because I think you know within the classroom, when you have order, structure, and masks, we've seen really minimal transmission in those settings. We had a situation at one of the local schools near Jackson where they had one teacher who exposed 25 kids over the course of 2 or 3 days before she realized she was positive. She was wearing a mask and a shield, and all the kids were wearing masks. And we tested every one of them, and not a single one got infected. So I think that's pretty demonstrative of how successful we can be if we're just willing to make those simple, small alterations to our operation.
People talk about COVID fatigue and about wanting to get the economy going. It actually sounds like if we take those simple public health steps, that is the route to getting the economy back open.
Absolutely. There's nothing worse for the economy than having an uncontrolled outbreak and having to do something drastic. I mean, simple steps now would absolutely prevent more drastic steps in the future.
Well, I guess now is the part where we start talking about where we're at, because we're coming toward the winter season. Everybody's going to be back indoors, cold weather, so forth. And the numbers are starting to show that. In fact, I saw yesterday you tweeted out that we're 60% up. Actually, hospitalizations are up 29%, and ICU's up 7.5. So it's not only the case numbers are going up, but also what's more important, I guess, is the fact that more people are filling up the hospitals. So are we facing what we faced over the summer where, we might run out of beds?
Yeah, and it could even be worse because we're going into a fall surge with fewer open beds. Still, the vast majority of bed utilization is non-COVID stuff.
Yeah.
So, it's almost like instead of having the glass, 70% full, we've got the glass 90% full, and now we're going to pour on more. It doesn't matter, what's in that beds. When you get overflow, you're not meeting the needs. And I would like to just really make it clear that it's not just COVID people who are going to suffer. It's people who have car wrecks. It's going to be people who have heart attacks and strokes. And like last summer, we did some crazy stuff flying people around. We flew somebody to Atlanta for a stroke because we couldn't get care here. I mean,
Yeah.
It's really, and we as a public, as the community, need to do our part to protect this. And that's just sadly not happening.
I had a friend over the summer, he got a motorcycle wreck, for instance, and he couldn't get in. He had to sit in the emergency room for 2 days because they couldn't get him a bed. So yeah, you're right. That does affect that on that. And two, we're coming into flu season, which I hope everybody's gotten their flu shot at this point. But I remember some in the last 2 or 3 years, or actually the last decade, but my friends who are doctors would say, all the ventilators are getting full from flu. So if we had a combination bad flu season plus this COVID, I could see that would be a disaster.
Yeah, we do have years when the ventilators fill up just with flu. I think maybe 16 or 17 was one of those years where we got really tight. But the sort of silver lining of it is those simple things, if we just choose to do them for COVID, will actually prevent flu transmission too. And so the critical piece that's missing, I mean, so at the health department, we're back up to about 100% contact tracing, right?
Mhm.
We have universal testing available in every county. And so those things obviously are not enough to prevent rising case burden. The piece that we're missing is the what we call the non-pharmaceutical interventions. It's the distancing, the masking, the small group sort of stuff. And that if without that piece, there's no real way to control it, at least until we get a vaccine.
The governor brought back the mask mandate to 9 counties. And I was looking at you've got Tupelo area, looks like it's really struggling right now. The Hattiesburg area as well. You got Neshoba, which I would imagine would be the Choctaws would be driving a lot of that. I mean, at this point, I mean, hopefully that'll take it down. Are there any other areas of the state that you're worried about that you think they'll have to bring back the mask mandate?
Yeah, Madison, Rankin are kind of rising pretty quickly. I mean, they're kind of right at the threshold. Harrison County actually is over that threshold now. They sort of missed the cut.
Yeah.
The coast actually worries me a lot, to be quite honest. The cruise in the coast, I think, is going to end up leading to a bunch of cases. We're already seeing a pretty significant increase. And it's not so much people walking around looking at cars outdoors. It's what happens in the bars and the restaurants.
Yeah.
And there's this weird phenomenon that I don't quite understand, but I kind of do. And we've seen it with outbreaks, is when people are at work and they're at their desk doing stuff, or like there's having a meeting, or sometimes wear masks to their own folks at work. But then if you put some food in front of them and you get together and talk, it's like there's some people, we think there's some force field around food. But I assure you there is not, because we've seen some major outbreaks related to people letting their guard down during meal or break times.
And like I said, that's such a Southern thing, food and family and getting together, which kind of brings me to the next stage. I mean, we got some major events going on right now that could cause possible real spreading events. One of them, I guess, Election Day coming up. The Secretary of State is not having a mask mandate. He's saying that masks are not necessary or not required. How safe will it be for the average voter? Because I know if you're over 65 or if you've got some threatenings, you could vote absentee. But I mean, what the average voter going in, say they do wear their masks or being cautious, how safe is it for them to go vote?
I think if we did sort of like a grocery store analogy, I think it can be done pretty safely. But the critical piece to this is going to be the critical mass of people wearing masks, right? So if everybody in there's not wearing a mask, but you are, then your level of protection is going to be a lot lower than we collectively wear it. So,
Right.
If it could have been done, or if it can be done, that there's mandatory masks in the polling places, I think that's a fantastic idea. So I do think it could be done pretty safely. I mean, as far as the politics of how it happens, we know how coronavirus spreads.
Right.
We know what to do to prevent it. You have fewer people in the room, you have stuff outside, you have masks on. So anything we could get to that would be beneficial. But obviously, I think some of those things are kind of off the table right now as we go into the election for right now. But, we are giving away for people who have chronic medical conditions or over 65 and want to vote in person, we're giving away these little medical quality surgical masks and eye shields. And we know that the surgical masks are probably better than the cloth masks. And then eye protection is very important. So it's not perfect, but it's one additional measure. Anything that we can do to kind of help make it more safe, we're really committed to doing it.
I remember early on watching, the videos from the people talking about what was going on in China, and they would wear their goggles and everything. And I think a lot of people don't know that you actually can get it through your eyes.
Mm-hmm. And, what we have seen too is, like in healthcare settings, the sort of minimum standard for interacting with folks is surgical mask, not an N95. This is an N95. So these are kind of hard to wear all day. They're kind of hard to breathe through, and they kind of bite into your face. But if you're wearing a surgical mask and eye protection for a brief encounter, even with someone with known coronavirus, your risk of getting infected is extremely low.
So also too, one of the things about mask is the amount of viral load you get. So the amount of virus, this would slow down, even if you got a little bit of virus and you wouldn't get the full amount, right? That makes a difference also.
Yeah, that's a real exciting line of research. And there is evidence, like, especially there's like sort of two cruise ships. There was one, then the Japanese one, and then the one in the Antarctic, where they had universal masks versus not. And they had a lot of people get infected in both scenarios, and the sort of breakdown of the population as far as at risk was pretty similar. But those who are wearing the masks got infected, but they weren't as sick.
Yeah.
And so there is, there's a, you remember the old saying, the dose makes the poison. And if you're micro exposed, it seems like you're micro ill. So, there are benefits, but also it will prevent you from getting infected at all to some degree. So we just need to, all these simple things we can do to stack. There is no silver bullet,
Right.
but there's lots of bullets, right? So we just need to use all our bullets to try to keep it down and not really have this. We have some mythical expectation that, one thing's going to be the panacea. It's going to be hydroxychloroquine is going to save everybody, or it's going to be, whatever new thing, or herd immunity, right? Which that's not really going the way that people think it is.
Yeah. You talk about food, and one of the big events coming up, I think Halloween, I've noticed a lot of neighborhoods are trying to do alternative things or trying to figure out ways around that. But the big events coming up is in November. It would be Thanksgiving, which that's when most Americans travel. It's one of the biggest travel days. It's when everybody gets together, and I'm really thinking, even in my family, I mean, my sisters and I are the oldest people now in our family, but still we're over 50. So, I mean, that could have an effect. What advice would you give somebody right now if they were planning Thanksgiving dinner? Should they do it? Should they do Zoom? What should they do?
I think I'd keep it nuclear, for the most part, keep it within your nuclear family, keep it within your household contacts. It's kind of hard for us to abandon every social custom, right? And I think people push back, and I've been hoping that we could find some middle ground that's safe. Unfortunately, we tend to jump from extremes, and both extremes are harmful psychologically, but also the economy or health or one or the other. We can't find balance. So, I think really just keep it small,
Yeah.
and keep it outdoors if you can. I mean, if you're going to we definitely don't need to be having big family reunion type meals. That just does not need to happen. If your kid's going to come in from college, and that's certainly going to happen. You're not going to not have, Thanksgiving with your kid. Maintain a little bit of space. Maybe get a heater and eat out on the porch if you can, or that sort of stuff. But just kind of keep it small, keep it tight, and try not to travel too much if you can.
Early on, African Americans were hit really hard by this virus, and I've noticed now that 60% of the new cases are now white patients. So there's been kind of a flip. One of the things I've told people, I said the virus doesn't really care about politics or much of anything. It just wants in your lungs, basically, to reproduce. What is driving that switch, though? I mean, it was like, I've noticed, like, if I go, and this is all anecdotal, but I mean, if I go to the store, usually, African Americans are wearing the mask, and usually white people aren't. Is that what's driving that number?
I think so. I mean, it's anecdotal, and I have the same observation. But even like in the school situation, the predominantly African American schools are more cautious than some of the more sort of affluent, sort of predominantly white schools. Just to be honest. So as far as like who's going partially virtual and that sort of thing, so I do think it hit the Black community so hard early on. It kind of snuck in under the radar. For a whole host of reasons, and I don't know if it's because they've lived through it personally and understand the importance of it. We have devoted a lot of our internal resources toward health equity, disparity groups, and minority populations, and I would hope that some of that's helped. But that's actually kind of been elevated to one of our main actions, and it might not be something you would notice, but we're out in the community interacting with churches, giving away masks, we have actually a whole testing unit that's devoted to minority populations. So hopefully that's part of it. And it may well be that, if you haven't seen a family member get sick or die, then maybe you don't take it seriously. And unfortunately, there's been all this weird stuff like, is COVID real? Do you know anybody with COVID? And, I think in some sort of sequestered rural parts of the state, maybe it was easy to sort of convince yourself that it was a hoax. But obviously it's not. We're going to see a lot more people get sick, die. A friend of the family, sort of like a distant, I mean, not a close friend of mine, but someone that we knew well, was kind of in that hoaxer sort of mindset and got coronavirus and died.
Wow.
Didn't have to, so I'm afraid that we're going to learn the lesson the hard way.
That's that seems to me a very frustrating part about this is sometimes it seems like some of this is so unnecessary if we've taken some of the steps, and that's really hard. Let's talk a little bit about treatment and where we're going with that. And I mean, I know your wife, Kim, she's a pulmonologist, so she deals with lungs, and she also is the chief medical over an ICU. So she's on the front lines also. The treatments, steroids were a big change and were a big help. It seems to have helped the numbers of the deaths go down a little bit. Talk about the treatments a little bit. If you get really sick, and of course, we saw what went on with the president, and I don't think we're all going to have access to that anytime soon. I think it was like $1.5 million worth of treatment he got. So we're not going to get that. But where do you think we'll be maybe in 3 months or 6 months? Because I know that everybody talks about the vaccine, but at the end of the day, are we going to be able to treat this thing?
Yeah, so I think there's a few things to unpack there. I think the most important thing is to recognize that good, attentive medical care is the most important piece. And early on, we were hearing this 80% mortality stuff out of New York and everything, and they were in chaos and just doing stuff. Taking care of sick COVID folks requires a lot of time, attention, and patience. And to have that, you have to have staff, you have to have beds, and you have to have resources. And so we've seen our mortality rate drop remarkably just from taking a deep breath and taking care of folks. And so I think that's one of the things that's so important about maintaining resource capacity, because the majority of the gains in mortality that we've seen have not been from a new medication. It's just been from the recognition that, hey, we need to take care of these folks and give them a chance to get better, because the human body is absolutely amazing. And I've seen, at least, vicariously through my wife's work, people who you would say there's just no way they're going to make it. And now they're back at home with their family and back at work. Just phenomenal stories if we can just do that. But if we get to medications, steroids do make a big difference. Really, it looks like they make a difference when you get in that secondary sort of inflammatory state, not the early sort of symptomatic and sort of viral state. And so that's a very strong, that's probably the most effective treatment we've seen so far for the really sick folks. Doesn't seem like it's appropriate early in treatment. It might actually make it worse. So, but we'll keep looking at that. Remdesivir probably has some benefit. There's been several sort of studies that say, yeah, it helps. No, it doesn't. It's pretty safe. And so probably some benefits. So certainly it's kind of expensive. Other stuff on the horizon, maybe the antibody cocktail, that Regeneron company thing might be good, but we're still waiting to see on that. But again, it's going to be extremely expensive. We're going to spend an unbelievable amount of money on this. But these things are cheap.
Yeah, exactly.
Hydroxychloroquine's kind of been a big one, and just as data continues to roll in from real trials, it shows that it's really not helpful. At the health department, we don't have any role in restricting what doctors use, what they prescribe.
Yeah.
And some doctors will do it off label, but really just hasn't shown any efficacy.
Everybody said when we're going to get back to normal. This thing's a coronavirus, like the common cold. The common cold, you get it one year, you can get it the next. Are we ever truly going to get back to normal? Or, do you think the vaccine will help us get that direction? Or do you think that this is going to be something that we just learn to treat and we learn to deal with in the long run?
It's so hard to know, but if you look at the different elements of what it would take to get back to normal, right? I think what we probably will get to is we'll get to a risk balance that's a lot more acceptable. Mm-hmm. So if you've had a vaccine, and if we've had, most people have had some variety of immunity, and it may well be that we have some ongoing elevated risk, but not kind of like what we're looking at. But even that's probably not really going to happen until next summer at the earliest.
Yeah.
And then, there won't be any kid vaccines probably until next fall.
Oh, yeah.
So we have a huge slice of the population that's not going to be there. But I'll tell you, and my wife and I have been talking about it, we would look forward to being able to travel again and stuff. And I don't think for the rest of my life, I'm ever going to go to an airport without a mask on, ever. Right. So I think there will be some differences.
It's funny because the resistance to masks kind of remind me of the resistance to seatbelts. It took a few years before everybody finally started wearing the seatbelts and realized that maybe getting thrown through the windshield wasn't a good idea a little bit. Do you feel like that maybe probably, like you said, eventually the people will get more comfortable with it?
I'm really hopeful. Certainly we've suffered from a lack of public health unity in our federal voices. And I think that's really given naysayers an opportunity to push back
Yeah.
inappropriately, unfortunately. But and there's probably a critical mass with a lot of things. You have to have, kind of like herd immunity. You have to have so many people who are immune. You have to have some people who are going to wear masks. And so, although I know there'll always be sort of outliers, and we're kind of an independent country and an independent state, and I'm from this free state of Jones myself, so I understand the mindset. But if we can reach a critical mass of people who will do it with regularity, I think that we'll get really just remarkable benefit.
Yeah, I'm kind of with you on that. I don't like being told what to do. I mean, it's kind of it's a natural Ramsey kind of thing. But yeah, I'm also kind of want to get back to where we can kind of function normal as a society and get going. And to me, it seems like a very normal way, a good way to do that a little bit. Is there anything that I haven't really covered as we're starting to wind down a little bit? Because I know you've got to go save the world. You got a little bit of
Oh, well, heavens no. Yeah, so I think patience. I mean, and enjoy the things that we can do. I've spent a lot more time outdoors, which has been fantastic. The other thing is, you said, how do you stay sane? Is I limit my exposure to social media. Oh my heavens. That it's designed to drive you nuts. It's designed to drag you in. So
don't read the comment section. That'd be my advice to you.
Oh man, it's a peanut gallery all over the place. Yeah, but there's simple ways for us to thrive.
Yeah.
But we got to be patient. So please be patient and be safe, because hospitals are going to be pretty tight for a while.
Yeah, definitely. Well, I really, really appreciate you taking the time and talking to us this day. And I want to say thank you for all the hard work you've been doing. Like I said, we've been blessed in Mississippi. We've, for the most part, had some really brilliant state health officers. And I think you're doing a great job on that. And I just wanted to say thank you for what you're doing. And I really enjoy drawing you in cartoons every third day. So that's been fun too.
Well, I look forward to that happening. Hey, I really like the one with the roller skates or the person, the running up the hill, the
marathon.
Yeah, no, that's fantastic. I love it.
I've done a couple marathons, and it's like, it seems like what y'all are going through is you're probably feel like you're on mile 20 about right now. So.
I'm afraid it's an ultra.
Yeah, it probably is. It probably is. All right. Well, thank you so much. And thanks for taking the time talking with us today.
Hey, thank you, Marshall. Good chatting with you.
All right.